United States healthcare. A solution or just a problem? And many times, Americans come off as having lots of pride. The national anthem is always sung at sporting events, and you can see the American flag displayed almost anywhere. I'm proud to be an American, but I'm certainly not proud of our healthcare system. In 2000, the World Healthcare Organization put together this report ranking the nations in order of how good their healthcare system is. The U.S. only ranked 37, just above Slovenia and Cuba. According to the Organization for Economic Cooperation and Development, out of 30 developed countries, the United States spent most of its gross domestic product on healthcare. The United States spent 16% of its gross domestic product in 2007. France only spent 11% of its gross domestic product and is still ranked 36 countries higher in the 2000 World Health Organization year report. Where is all the money going? With all that spending, the ranking of 37 is very surprising, and according to the New England Journal of Medicine, the United States only ranked 39th for infant mortality, 43rd for adult female mortality, and 42nd for adult male mortality. These numbers are shocking, so why do we spend so much to get so little? As stated in the Milbank Quarterly article, Waste in the U.S. Healthcare System by Tanya G.K. Bentley et al., researchers have been comparing the United States spending on healthcare to Canada's to help quantify the administrative costs that the United States is spending. As noted in the article, the United States and Canada are very culturally similar. Operational waste is one thing that they looked at when comparing the U.S. and Canada. Operational waste is the inefficient and unnecessary use of resources in the production of delivery and services. This table shows the types of operational waste that can occur. There's duplication of services, where tests and procedures are done more often than they need to be. There's inefficient processes, where there's time spent waiting and unnecessary transport. There's overly expensive inputs, where doctors perform services that nurses can do, and prescribing brand name drugs when the generics are just fine. And the big one is errors, which can include defective machines and the rework of tests and procedures that didn't turn out right the first time around. All these errors can be expensive to the patient as well as the hospital. A lot of these errors can cause preventable deaths. In fact, according to Waste in the U.S. healthcare system, the U.S. in particular performed the worst among 19 industrialized nations at preventable deaths. With all the money the United States spends on healthcare, the United States should be better at preventing medical errors, which they're clearly not. In fact, there's an estimated cost between $17 billion and $29 billion annually that the United States spends on medical errors. This is compared with Canada, who only spends $750 million per year on medical errors. Medical errors is one place that the United States spends their money. Where is the rest of the money going? The United States has 1.3 nurses per bed, 5.8 physicians per capita, and this is right on average with all other industrialized countries. Where the United States lacks is the number of hospital beds, admissions, and length of hospital stay. The United States was slightly below average in all of these. With all that money the United States is spending, how can it be below average in anything? And again, where is all the money going? According to Gerard F. Anderson et al., in The Price is Stupid, Why is the United States Different from Other Countries? In the United States, healthcare worker salaries, medical equipment, pharmaceuticals, and other supplies are more expensive in the United States than they are in any other country. They emphasize the point that healthcare worker salaries are higher in the United States than they are in other countries. Let's take a look at this. This list, supplied by the Congressional Research Service Analysis of Remuneration of Healthcare Professionals, OECD data in 2006, shows that the United States pays nurses and general practitioners more than any other industrialized nation. $56,000 for nurses and $161,000 for general practitioners. This is way above average. The United States also was third in salary for specialists, but still paid them $230,000, whereas the average was only $113,000. Does the United States really need to pay their healthcare workers this much? This clip I'm about to show is from Michael Moore's Sicko video, which is a documentary about the highly profitable American healthcare industry in other nations. In this clip, Michael Moore is talking to a doctor from the UK. Even though he does not get paid as much as the United States healthcare employees, he's not complaining at all.
If you want to have $2 or $3 million homes and 4 or 5 nice cars and 6 or 7 nice televisions, then maybe practice somewhere where you can earn that.
You're getting by okay on the $1 million home, the Audi, and the flat-screen TV.
Yeah, we're coping with those.
This clip shows that although he is not making as much money as United States healthcare workers, he is still making more than enough to get by. Maybe the U.S. government really does not need to pay their workers as much. The movie Sicko has lots of other interesting points and is the reason why I became interested in the U.S.'s healthcare system. There are many very shocking facts about healthcare in the movie Sicko. 18,000 Americans will die this year simply because they are uninsured. In a study of older Americans and Brits had less of almost every major disease. Even the poorest Brit can expect to live longer than the richest American. The United States healthcare system isn't completely bad, but it does have a lot of major flaws. It needs a lot of help to get its low ranking of 37 up higher where it should be. Because the United States spends more on healthcare than any other country in the world, it should not be ranked so low. If the United States focused more on preventing errors and paying medical workers slightly less, they might be in better shape. I sure do hope the new healthcare reform helps the country out.